Hello again. This is Dr. Michael Wehrle on an interesting case that I did when I was a relatively young implantologist. As you're going to see, I made all sorts of interesting decisions here, but I'm only about 3-4 years in implantology when I did this case, but it is an interesting one, so let's take a look at it. And it also shows that, hey, we all grow as we get better and we put more work into it. All right, so this lovely lady came in to me and she's missing her upper right. The bridge had broken off, actually. And that's what it looks like from the top down. The post had come out of the canine. There's no bone up there really to speak of in the posterior, so I decided to do a lateral sinus lift. The interesting thing here is, if you can see this right here, is I saved that broken down canine. Nowadays, I would definitely put an implant in there. But I saved it, and it worked. The root canal worked. I retreated it. The post worked. It's still in there today. So far, so good. But in hindsight, I would have added another implant up there. So here I am making the window. And then you're just pushing the window up using a little hinge technique there. And then I'm packing some bone in there after we get the membrane pushed out of the way. And I've got the all sutured up and ready to go. And then while I'm letting the upper right heal, because a sinus lift has to heal for about 6 months for the bone to really to turn over, I said, all right, let's go down and take care of the lower left. The lower left had a bridge too, and it was on its way to breaking off and failing. And you can see the abscess in the tooth number 18 for cation involvement. So we said, you know what, let's just take this all out of here and go with implants. So in this one, I used a piezo to do the ridge split because the ridge is pretty small, as you'll see when we go over the x-rays at the end. And then I used a Versaburr to widen it out. This can show you how long ago it was, back when Versas were still silver. So then it kind of seemed like the threads were showing through on the implants. So I decided, and you can see that little defect over here in this upper left corner. You can see that bone there. It's got a little defect there, but it's got a natural little hollow that you can fill in nicely with bone. So I thought, you know what? Let's do belts and suspenders here. And I had to graft that back extraction site anyways. So I just grafted the whole thing, put a membrane over it and closed it up. There it is, healing a little while later. And a little while further along to the right. Okay, so we did second phase surgery, opened it up, and you can see what the tissue looks like when I take those healing abutments off of there. We did a good job repositioning the tissue too. We did a little apically repositioned flap in there. And you can see that tissue looks pretty nice. And that's the final restoration there, other than some amalgam tattoo that she's got on the gingiva. That's a pretty nice restoration given what we started with, which, again, I'll show you in a second. All right, now we're back to the upper left. So our little friend here this is right after the surgery. This is about a couple weeks after. You can still see that it's healing up. Once it's healed up for 3 months, you can see the interesting choice that I made also toward the back. Even though I was doing a lateral sinus lift, I was doing an extraction of number 2, which I thought to myself, you know what? I should probably just do this all at the same time. I'll just go ahead and do it immediate up there. Hindsight being 20/20, I definitely should have just grafted the whole area and then come back and placed all the implants at the same time. And you'll also notice, if you can see right here, there's a little bit of thread showing on that too. So I noticed all this. I said, you know what? I'm just going to place 4 new implants. I'm going to take that one out. So I pretty much just unscrewed that one to get it out. It wasn't in that soft bone very well. And away I went. So I put 4 implants in there. And I apologize. This is also very early in my photography career. So I don't have all the x-rays, the pictures to show you that I normally would. You can't see that I did. This was my pedicle flap days. I was pedicle flapping just about everything because I just learned how to do it. So I was sliding the bone over, which is better to get that closed over on top of the ridge rather than down there on the palate, because the palate's just going to granulate right in, as you're going to see. All right, so there's my implants. There's four there. The other fourth one is hidden right here by the crown. It's right distal to this crown up here to the left. So I now have, as you can see on the lower picture, 4 implants in place. A little bit catawampus, but not too bad. And again, the ever-present pedicle graft. All right, so, but once again, it's a pretty good result. The tissue's healed up nicely, and it's going to be a bridge where you're going to connect these together, or at least you can connect 2 of them together, split 2 each time, so being a little bit off-center isn't a kiss of death for you. And as you can see, we have very nice attached gingiva around there. Again, we were very conscious of making sure that we had enough. And that's what it looks like now. We've got the 4 implants in place up there. There they are. A little bit off center. I think we actually went with individual implants here. Individual crowns, excuse me. And there's the crown that I did. That shows how long ago it was. I was still using porcelain fused to metal. This was 2017 or 16, I want to say. So here is her final case. She's pretty happy with that. She's walking out the door, and she's got teeth up there. She's got teeth down there. She's got a decent smile, and she can chew and function, which she could not when she came in. This was a tragic case. She actually was mugged, and she was beaten badly, and that's how all these teeth got broken out of here and loosened up. It was a pleasure to work on her. She was still joy-filled after this. And I'm going to just tell you that we work on people, not teeth. And this was a pretty good case, especially given my my experience level. So let's look at the x-rays now to get some more idea of what went on here. This is number 20. There was some decent bone there. I probably could have snuck a 4 in there, but we grafted that anyways because I was grafting the whole thing. Remember, I put some bone graft. I did belts and suspenders. That's what you're seeing out here to the buckle. Same thing over here. This whole part has now been grafted over by the bone graft that I did, setting in there very nicely. That's number 19, by the way. Sorry. This is number 18. Used a huge healing above. Not quite sure why I went quite this big. That's kind of crazy. But you can see that bone got wider also from there over to there. The grafting worked very nicely there. So did the ridge split. The combination of the two was very acceptable. Okay. So now we're looking at, this is the upper left. We're working our way back from tooth number 6 was the one that had an implant. And by the way, all this time watching the implant on the CBCT, I wish I had shown you this. It healed in beautifully. Had a nasty little abscess underneath it. And it's completely healed over now, and the root canal's working great. But this is the bone here. So this bone was pretty good sized anyways. But I did a graft out here when I did the sinus lift because I wanted some more bone, and that took very nicely, as you can see here. That's a much better piece of bone to work with than that is. There we go. Over here, as we moved further back, this is number 4. And this has... pretty good piece of the bone graft went up in here, and we got into that over there very nicely. Now, again, early on, this is like my third lateral sinus lift ever. I wasn't getting quite far enough over there. It would have been nice to get over. So you just put the implant over there, but we all know that you want to fill that all the way over. But I used a Versaburr, and I slit some of the bone over, and that turned out pretty nicely, actually. As you can see there. This is the very back tooth where I did the extraction. This is ever so slightly actually in front of the extraction site. I did graft the extraction site. I took out that implant. I grafted that. And this was right, as I say, in the mesial part of that tooth. That's pretty nice. This is a showing of the progression of it, how they came in. I did the lateral sinus lift here and placed that first implant. Here it is healing over here. While we're waiting for this to heal, we took this tooth out, grafted it, and put 3 implants in down here. Here it is over here. You got the 3 implants healed here, the 4 healing up there, and then we have them all restored here at the end. It was a nice little staged case, and it took us about a year to do this, and she was quite happy when she was done with this. Anyhow, really appreciate you guys spending some time looking at this and taking a little walk down memory lane. Sure enough, there's 2017, like I said. So, not bad for early on in my career. And just showing you something, too, for those folks out there that are just starting out or a couple, 3 years into it. Well, you can still do cases like this. You just have to take the CE and grow and get better. If you want to be able to do cases like this, you're out there, you're just starting in implant dentistry, this is what you need to do. You need to join the American Academy of Implant Dentistry. That's what I did early on. That's who taught me more than anyone else, from going to all these meetings and have so many great mentors. And this is just a fantastic organization. As you can see, it's the oldest, it's the best. Go ahead and click on the QR code or the link and join the American Academy of Implant Dentistry if you want to be able to do cases like this. The other organization that I want you to join is the American Independent Dental Alliance. It's an organization that's focused on helping offices remain independent, quality focused, profitable, and competitive with larger DSOs. What does that mean? Look, it's not a level playing field out there. The big DSOs can do this. They're better financially, but I don't think they're necessarily better dentally for the patient. I just don't believe that. Like, an independent dentist making his own decisions for the best treatment for this patient is better than a corporation doing it. So I believe strongly in them, and this is the QR code and the website if you want to go to that. This is Mike Wehrle, and thank you for joining me on our shared implant journey.